5 myths regarding infertility. Hi everyone. Today the topic of discussion is common misconceptions and myths about infertility. I am Dr. Meeta Airen, a fertility consultant at Zeeva Fertility, Noida. So this is a very important topic which the common public should know, and these myths are very common in social life, and because of these myths many patients they don't turn to the doctor, and they just believe these myths, and they don't try to conceive, and they just think that in period of time they will conceive, and that important time when they should take treatment and try to conceive, it passes off, and later on they feel problem. So I will tell you one by one what myths are usually prevalent, and they should be clarified. So first misconception is people usually think that infertility is a female's problem. So this is a very wrong misconception, because the conception is equally distributed between both the partners, female as well as the male partner. Out of all infertile patients, approximately 1/3 of the patient couples, they have a male fertility issue. 1/3 of couples have female infertility issues, and 1/3 of the couples, they have both the issues, male as well as female. So it is not that female only is responsible for infertility. As a couple, if you are having difficulty in conceiving, you both should go to a doctor and get yourself checked up, so that you can at least come to know what is the problem and where it can be treated. So this is the first misconception, so it should not be believed on. Then second misconception is that infertility is just because of stress, and it is just be relaxed and you will conceive. This is not the scene. Yes, definitely stress affects the fertility, but it is not that only stress is the factor which is causing infertility. Rather, it is vice versa. Because of infertility, the stress is developed, and then again because of stress, again you are not able to conceive. So the only stress is not the only factor. There are many factors, scientific factors, there are physical factors in the body, like in female's body as well as in the male's body. There are many factors which are responsible for infertility. So you have to be realistic, and just do the diagnosis, and then if the diagnosis is done, then take the treatment and then relax, so that you can conceive. So this is the second thing which you should not be relying on, that only stress is the factor. Then the third factor is the age of male as well as female does not affect fertility. In the current scenario, most of the female and male partners, they are busy in their studies and career building. So because of late marriages as well as after marriage, they think that now first I have to settle my career and then I will try to conceive. So they just pass the age group of about 30-35 years, and then they start thinking. But because of this misconception, that age is not affecting fertility, they actually miss the period where the fertility is maximum. And once they realize that yes, age is a limiting factor, then they are already late. So age is definitely a limiting factor. Especially it is more in cases of females. After the age of 33 or 35, fertility quickly declines in females. Nowadays, because of certain environmental factors, this age is a little bit going reduced day by day. But in males, it is after 50-55 also there is the fertility is affected. So importantly, in females, the age is very important rate limiting factor for fertility. Now these are the further things. Now one more myth I can just recall is some people, they say that taking oral contraceptive pills, it causes infertility. This myth is also wrong because once you are taking oral contraceptive pills for your family planning, it is not going to affect your fertility. Yes, definitely, once you stop taking oral contraceptive pills for 2 to 3 months, it may delay your conception, but not beyond that. So, this is also a myth that oral contraceptive pill is causing infertility. Now, the last and most important is fertility treatment is very expensive and it is very painful. So, I am not going to go for a fertility treatment. So, this myth is very wrong. Previously, yes, a few years back it was very expensive, but with the invent of many new techniques and things, this treatment has become very approachable and it is not very expensive nowadays. So this is the thing. And also some females are very afraid of going for an IVF treatment because they feel that it is very painful. So importantly, this IVF treatment is not painful at all. Basically it involves few OT procedures like egg retrieval procedure and embryo transfer procedure. The one procedure which is egg retrieval is painful, but it is done under anesthesia so that the patient doesn't feel any pain, and the other procedure is not very painful. It is done without anesthesia because it is not painful. So this is also a myth. So IVF treatment to start with, it is not expensive as well as it is not painful. Thank you so much.